Hello and welcome. Today we're diving into a complex and often overlooked aspect of heart disease: metastatic cardiac tumors. This refers to cancers that originate elsewhere in the body and then spread to the heart. While primary heart tumors are rare, metastatic involvement is significantly more common, presenting unique diagnostic and therapeutic challenges. So, what causes cancer to spread to the heart? The heart, despite its rich blood supply, isn't a common site for metastasis. However, certain cancers have a higher propensity to spread there. Lung cancer, breast cancer, melanoma, lymphoma, and leukemia are among the most frequent culprits. The spread typically occurs through several routes. Direct extension, where a nearby tumor, say in the lung or mediastinum, invades the heart directly. Hematogenous spread, meaning cancer cells travel through the bloodstream and lodge in the heart tissue. Lymphatic spread, following lymphatic vessels to the heart. Less commonly, cancer can spread through the vena cava. Now, let's understand how metastatic tumors affect the heart. The pathophysiology is complex and depends on the tumor's location, size, and growth rate. The tumor can directly infiltrate the heart muscle, interfering with its ability to contract and relax properly, leading to heart failure. It can compress or obstruct blood flow through the heart chambers or vessels, causing valve dysfunction or superior vena cava syndrome. Some tumors produce hormones or other substances that disrupt normal heart function. Pericardial involvement is common, resulting in pericardial effusion, potentially leading to cardiac tamponade. Arrhythmias can occur due to tumor infiltration into the heart's electrical conduction system. All these factors ultimately compromise the heart's pumping ability and overall cardiovascular function. Regarding the epidemiology, metastatic cardiac tumors are relatively rare, but their exact incidence is difficult to determine due to underdiagnosis. Autopsy studies suggest that metastatic involvement of the heart is found in a significant percentage, ranging from 1.5% to 20% of patients with widespread cancer. The true prevalence in living patients is likely lower, as many cases are asymptomatic or discovered incidentally. The most common primary cancers to metastasize to the heart, as mentioned earlier, are lung, breast, melanoma, lymphoma, and leukemia. Recognizing metastatic cardiac tumors can be challenging as symptoms are often nonspecific and mimic other cardiac conditions. Many patients are asymptomatic, and the tumor is discovered during imaging for their primary cancer. When symptoms do occur, they can include chest pain, shortness of breath, dyspnea, palpitations or arrhythmias, fatigue, swelling in the legs and ankles, edema, and unexplained weight loss. Symptoms of pericardial effusion, such as shortness of breath and chest pressure, may be present. In severe cases, cardiac tamponade can develop, leading to a life-threatening drop in blood pressure. It's important to remember that these symptoms can also be caused by other heart conditions, so a high index of suspicion is needed in cancer patients. Diagnosing metastatic cardiac tumors often requires a combination of imaging modalities. Echocardiography, both transthoracic and transesophageal, is usually the first-line investigation, providing real-time images of the heart's structure and function. Cardiac MRI offers superior tissue characterization and can help differentiate tumor from other cardiac masses. CT scans are useful for assessing the extent of the primary cancer and any other metastases. PET-CT scans can detect metabolically active tumor tissue, aiding in the diagnosis and staging. Biopsy, either through surgical resection or image-guided percutaneous techniques, is often necessary to confirm the diagnosis and determine the tumor type. While we don't typically classify metastatic cardiac tumors into distinct types, in the same way we do with primary tumors, it's important to consider the location and extent of involvement. Tumors can affect the pericardium, the myocardium, the endocardium, or even the heart valves. The location of the tumor significantly impacts the symptoms and treatment options. Treatment of metastatic cardiac tumors is complex and multidisciplinary, often involving oncologists, cardiologists, and surgeons. The primary goal is to control the primary cancer and alleviate cardiac symptoms. Treatment options include chemotherapy, radiation therapy, targeted therapy, and immunotherapy depending on the type of cancer and its sensitivity to these treatments. Surgical resection of the tumor may be considered if it's localized and causing significant hemodynamic compromise. Pericardiocentesis, draining fluid from around the heart, may be necessary to treat pericardial effusion and cardiac tamponade. Supportive care, such as medications to manage heart failure or arrhythmias, is also crucial. Preventing metastatic cardiac tumors is largely dependent on preventing and effectively treating the primary cancer. Early detection and treatment of cancer through screening programs and prompt medical attention are essential. Maintaining a healthy lifestyle, including a balanced diet, regular exercise, and avoiding tobacco and excessive alcohol consumption, can reduce the risk of developing cancer in the first place. The prognosis for patients with metastatic cardiac tumors is generally poor, as it indicates advanced cancer. Survival depends on several factors, including the type and stage of the primary cancer, the extent of cardiac involvement, and the patient's overall health. Recent research focuses on developing more effective systemic therapies and targeted treatments to improve survival and quality of life. Advances in imaging techniques are allowing for earlier and more accurate diagnosis, potentially leading to earlier intervention. There is also ongoing research into the role of immunotherapy in treating metastatic cardiac tumors, showing promising results in some cases. Ultimately, the management of metastatic cardiac tumors requires a personalized approach, taking into account the individual patient's circumstances and goals.